What are the risks of inconclusive results in embryo genetic testing? Imagine trying to solve a puzzle but missing some key pieces. That's what inconclusive results in embryo genetic testing can feel like for patients and doctors alike. When testing embryos through methods like preimplantation genetic diagnosis or preimplantation genetic testing for aneuploidy, sometimes the lab can't give a clear answer about the embryo's genetic makeup. This can happen because of issues like poor sample quality, technical limitations, or lab errors. One big concern is the uncertainty about the embryo's health. If the results are inconclusive, doctors and patients face tough choices. Should they transfer the embryo knowing there could be a hidden genetic problem? Or should they wait and do more testing? Transferring an embryo with unknown risks could accidentally pass on genetic conditions. That conflicts with the ethical principle of doing no harm. Inconclusive results might also mean more invasive procedures, like rebiopsying the embryo. But each additional biopsy can harm the embryo or lower its chances of developing successfully. So, while trying to get clearer information, there's a real risk of damaging the embryo. Patients often feel stressed and anxious when results are unclear. The lack of certainty makes decision-making harder and can cause emotional strain. It also challenges their ability to give informed consent because they don't have full information about the embryo's health. This can affect their trust in the medical process and increase psychological distress. Another issue is delays. When results are inconclusive, embryos often need to be frozen while waiting for further testing. This can slow down the whole process of pregnancy, especially if multiple cycles are needed. It can also raise questions about fairness, as not everyone has equal access to repeated treatments or extended testing. Financial costs can also rise. Additional testing, extra IVF cycles, and longer treatment times add up quickly. This can be a heavy burden for many families, raising questions about resource fairness and affordability. Most of these risks come from technical limitations in the lab, not from the embryo itself. Improving lab techniques and standards can reduce inconclusive results. Better training and equipment help ensure more accurate and reliable testing. In the end, inconclusive results in embryo genetic testing pose risks like potential harm to the embryo, difficult ethical choices, emotional stress, delays, and higher costs. These issues highlight the importance of clear communication, careful decision-making, and ongoing improvements in testing methods to support patients and uphold ethical standards.